just tell you a little bit about myself. Is that I'm did my undergraduate here, and then I got my graduate here in nursing, and so I'm pretty much an Aztec for life. Got hired, and I'll stay here until I retire. So I love it. I love working here. I'm making you guys crooked in that come out. So. Anyways, the student health services, I think, is an extremely important aspect of a student's life, because without their health, they're not going to be able to participate in classes and to maintain their job, to exercise, to keep their health going so that they can keep staying in competitive class. Our mission here is to help San Diego State students develop and maintain lifelong health and well-being through campus-wide and individual health promotion, education, and through cost-effective and convenient, high-quality professional medical care. And I worked at other places. I left and worked at UCSD at one point, and another large health organization, just to prove to myself I could do it, and came back because the quality of care that we give our students and the attention that we paid our students was so much better than what I was being forced to give out in the real world. I wanted to come back. So assessing medical services is pretty easy. I know we have problems from time to time with our phones. We continually are working on that. We just get such a high volume of calls. I supervise the nurses, and it's amazing. They're getting 50 to 75 phone calls a day, and that's just coming in on the nurses' line. So it's really busy, but the best way to do it is 619 to tell people 594-4325. You can also make a lot of appointments on Healthy Connection. Healthy Connect is a wonderful way to get your lab results and for people to schedule appointments. You can schedule appointments for a variety of different things. You can self-schedule self-directed STD testing now through Healthy Connect. You can communicate with your doctor or your nurse practitioner. It's an excellent way to access people, and then you can avoid the phone line. After hours, we have pamphlets all over near most of the major doors for the after hours advice nurse. So students can call and they can give their red ID number and talk to a nurse and be advised on healthcare and current issues at that time. Executive Order 943 is what sets the tone for all of the CSU system as far as what we offer. They designate the student health fees for us to cover certain basic services. That fee is $150 per semester. It's $110 for students during the summer. There's also the facilities fee, which is $25 and $19 during the summer. Augmented services may be provided at cost. Like we have an orthopedic doctor who comes in on Wednesday afternoons and sees our patients. Nowhere else in the world will you see an orthopedic doctor for $30 or see an osteopath for $30 or $15 per visit. So those are some pretty exceptional values that we're able to offer our patients special services. Each campus gets to decide which augmented services that they provide. Some campuses offer massage. I think you should do that. So it's just every campus gets to decide what augmented ones we do, but we all have to offer the basic services. So appointment care is done through Medicine East and West on the second floor. You get advanced appointments. So, and same day appointments. We have 7 physicians, 6 nurse practitioners. We do everything from sexual health, STDs, checks, contraception, colds, sore throats, musculoskeletal injuries, lots of skateboard accidents, headaches, skin disorders, and we do see more complicated issues. I saw a 63-year-old woman once and diagnosed her with breast cancer. She was a student. So they're not just all your age, and they're not all just coming in for STD checks and colds. So the providers here have to be really skilled at everything, so you never know. I teach nurse practitioner students, and I'm always telling them, students will come in the door and it looks like horse, but there's a zebra in there and you can't get lazy, you have to really pay attention. And so I think our providers are amazing at really paying attention to each patient that walks in the door. So if you needed something that we were not able to handle, like some kind of a specialist, like maybe an endocrinologist or a nose and throat doctor, we have specialists that we refer to, and they work with our students to offer discounted fees or cash discounts, or we can also help you with getting your insurance to pay if you have outside insurance. We don't have emergency services. A lot of times students walk in like they've just crashed their skateboard or been hit by a car and seem to be really surprised that we're not able to help them and we have to send them out to an ER or something. So we do have a triage protocol that we use to guide where we send patients and how we treat them. And that way, basically, everybody's getting the same care, and we don't have to address each thing, but we can look, and we have some guidelines for that. Nurse clinic, which I'm really proud of. When I updated these slides, I went from 2 nurses to 5 nurses. So on any given day, I've got either between 4 or 5 nurses, and I'm sorry, I'm the nursing supervisor, so I take ownership of nurse clinic. And they're doing an amazing job. They see so many patients every single day. And they really want to be helpful. They are specially trained, so when you walk in, they assess patients to see if they can help them. And a lot of times, we've got young students, 18 years old, before when they got a cold, they went, "Mom, I don't feel good," and Mom said, "Here, take this," right? And now I don't feel good, what do I do? So they come in, and so the nurses give them advice on self-care, what to do. It's not, you don't have scabies, you got a little rash. So they do a whole lot of things. They're skilled on this, on giving self-care and telling you what to do, how to treat yourself and what to do. They also, they've been specially trained to provide you with certain, with help for like uncomplicated bladder infections. We have a protocol for that. So they can actually do an exam on you, like just check your kidneys, make sure you don't have a fever, find out what's going on, and prescribe an antibiotic or give you an antibiotic that one of us healthcare providers have prescribed so that you can be treated for a simple bladder infection without having to wait for an appointment. If you have a sore throat or you get tested for strep and given an antibiotic that's appropriate to treat you for strep. They're now emergency contraceptives. If they go through the list, if you've had unprotected sex, this is for the females, guys. Maybe we have a pill for you so that you can prevent an unwanted pregnancy, and they're also trained in that, and they can give you that. And also now patients can walk in or make an appointment and get STD testing. We give patients information on how to do that, the questions, they get to pick what they want. The nurses put the orders in the computers, and then we let you know through Healthy Connect or a letter what your STD results were. And you can make that appointment online. That's huge, that you don't have to wait to see a provider. And it's only for people, of course, who don't have symptoms or haven't been told they've been exposed. But still, it's good when you just want to know or you want to check that you can go and do that. At times, the nurses they will refer you to a provider, or maybe say you need to go to an urgent care or an emergency room and make sure you get the information you need to get there. Is there any questions about that? Family Pact is a program, it's a state-funded program. They provide health promotion, can help on the 3rd floor, can help sign you up for that. They provide birth control, condoms, and pay for those things, and safe sex supplies, and screening and treatment of STDs and bladder infections or vaginal infections. There are eligibility rules that they need to look at to see if you're on your parents' tax return and different things like that if you already have insurance. But you can go down to health promotion, or the students can go to health promotion and get more information on that. Medical specialty services, like I was talking about, augmented services, psychiatry. These don't cost you anything extra. We have now 2 psychiatrists, Dr. Martin Greenberg and Daniel Rott, and those services don't cost anything extra. Osteopathic manipulative therapy is done by Dr. Hull. Dr. Hull is a physician, he's a medical doctor, but he's also trained in bone manipulation and tendons and ligaments, and threw out my shoulder once and had it in a sling and couldn't move it, and did some stuff on my shoulder and I was able to move it. It's amazing. He's done amazing things for patients with scoliosis, but that's a specialty service that you do have to pay extra for. Dr. Brenning is usually covered by Family Pact, or you may need to pay for it if you don't have outside insurance and you don't qualify for Family Pact. But that's a follow-up for abnormal PAPs, and we're not seeing a lot of those these days. But he does those. We have a sports medicine doctor, Dr. Greg Castaldo. He doesn't charge an extra fee for you to see him. But if you're an athlete and you've got like a repetitive injury or something that you need to see him for, you can make an appointment to see him. And then our orthopedic doctor, Dr. Kopp, he is one of the specialty services that you would need to pay for. And athletic medicine is, we have special contractors and physicians and fellows who work with the athletics department. And they are located in the Fowler Athletic Center, and they're overseeing, I try to say his name, but I mess it up, his first name's Patrick. And he oversees all the athletic trainers. Club sports also, participants are seen here, but varsity are seen through the athletic medicine directors. Dentistry, we have a dentist. She's here 2 days a week now. She used to be here just 1 day a week. And so we do full dental care. We have state-of-the-art dentistry. It's better than my dentist, where you go and sit in the chair, you got a TV in front of you, they lay you back, you got one on the ceiling. So it's pretty sweet. And they've got all the x-ray equipment, they do everything there. They even do Invisalign. And so it's a great service. And new patients who go in there, they're offering a special on teeth whitening too, if you want to go in there. And they do take insurance. So that is one of the things that you need to look at your dental insurance and see if they can help you find out if it's covered there. Optometry, they do all the usual eye services and glasses and contacts. Testing, things like that. We have a good selection of frames. We've got some really cool frames. She's here Monday through Thursday. And a lot of times if somebody has an eye issue, it's good that we feel that the nurses feel it would be better, you would be better served, and the students and patients would be better served by seeing the optometrist rather than seeing one of the regular providers. They'll recommend that also. And there's sometimes a $20 fee for people to go and see her. Okay, but generally, people can come in for almost anything and get seen. Immunization department, the dreaded eye hold. You guys have probably all heard about that. The immunization hold. Everybody needs to have had 3 hepatitis B shots. We're now requiring 2 MMRs. And if you don't submit your immunization records by your 2nd semester, you can get a hold and won't be able to register. And when people find that out, even though they've been told for quite a while, you need to take care of this, they panic at the last minute when, 2 days before registration, they're trying to call, the doctor that they had when they were 6 years old and get all their records. So immunizations, there's information on the our webpage about how to take care of your eye holes, and we really try to deal with all those really quickly. We're having everybody upload their immunization records now. There's information on how to do that on the webpage and on the registers page. And I've been told also when they send you your information to tell you about registering, they tell you how to do that too. If you need a TB skin test for a class or your job, you can get that there. If you are somebody